Good morning, everyone. Thanks for joining us. I know it's been a cold week. I do want to thank the towns, villages, and cities throughout Dutchess who have opened up facilities, community centers, their town hall, or perhaps their libraries. And you should, if you know of any individual needing a little bit of assistance, keep an eye out for those buildings being open from time to time as warming centers. The same respect as neighbors, it's a good time to check in on your homebound neighbor and perhaps just make sure that their heat, their homes are doing okay. It's been a cold week. It's going to be a cold weekend. Thankfully, not a significant amount of snow. Although I say thankfully, I think most people don't mind a little bit of snow in the winter. Excuse me, but it's just cold. Not enough, not much snow. But check in on your neighbor, in particular those who are homebound. So we want to get into a lot of the data today. We are on the other side of a peak. The question is how fast and how long will this decline in cases continue? We are hopeful and believe that we are going to see a prolonged reduction in case numbers. You've seen the state and likely the governor speak about this lately. I think it was about 3 weeks ago we said we're very close in the Hudson Valley to what we thought was peak as far as the rate of new cases and then ultimately the number of total positive cases. I will admit some didn't think we were being terribly honest at the time, but we could see that sort of slowing of growth with the expectation that we would hit peak, and we did about a week ago. And again, the question becomes how long and how far does this decline continue? We think that it does significantly. We are in the 11th day of declining positive cases, down from our 8,516 positive case peak on the 8th of January. We are now at 2,105 active cases and 160 individuals are hospitalized. Today, I want to dive a little deeper with you on the hospitalization numbers, talk a little bit about what we know about those who are hospitalized. There are a good number who are there because they have COVID, and then there are a good number of those who are there for other instances who test positive with COVID. The other, I'll say up front, I do want to talk a little bit about the fatality data. The state has finally started providing access to some of that information, and our local hospitals have provided us a greater look, if you will, under the hood. And I don't mean to be dismissive at all about the topic, but a greater detail as to the data related to fatalities. Now, we were talking about this about a year ago, and thankfully we were able to get access to the data necessary to kind of talk a little bit about that more today. So we are on the 11th day of decline of active cases, significant, a steep decline in total cases, 8,516 on the 8th of January, down to 2,105 active cases. We are seeing a slowing and a reduction in hospitalizations. That's a bit of a lagging indicator, fatalities being the final of those lagging indicators, if you will. But we are on the other side of this peak and likely have been for about 7 days. Now, our largest number of new cases during the time period of December 19th to January 15th are occurring between those who are 20 to 29 years of age. That's 18%. 17% of those 30 to 39 years of age represent total new cases. 17% of those new cases are 30 to 39 years of age. We are averaging 2,907 tests. Now, this doesn't include take-home tests, which is one of the reasons we've backed away from the positivity rate. We don't have an effective positivity rate is no longer a meaningful data point. Can't do the equation necessary because there's decent enough access to over-the-counter tests, or you're getting them sent to you, or you're picking them up. And so 2,907 tests that are in our system, that's what we're averaging daily over the last 7 days. Nearly 62,000 tests were conducted in Dutchess County over the course of the last several weeks. So from the beginning of this new year, 62,000 tests have been conducted. In December, I think we conducted 80,000 tests alone. We are seeing a decline in the demand for testing, and again, that has a lot to do with how public officials, how the media communicates this message, and so there's always a concern, and obviously ramping up, if you will, when people have a degree of concern. But we're seeing a decline of testing. We're averaging 490 new cases per day over the last 7 days. That's an average. That is against and compared against the 816 new cases we saw in the prior 7 days. So average daily new case count, 490 new cases per day averaged over the last 7 days. That is a steep decline from the 816 we saw on average the 7 days prior. The data point you'll see on the dashboard, and one of importance that we'll continue to reference, 139.6 new cases per 100,000 residents in Dutchess County. That puts us like in the middle in the region. 581 individuals have succumbed with and because of this virus. Now, I do want to mention and dive a little bit more into that particular data. So based on the information we have from local hospitals, which accounts for about 80% of the death-related data. So I do want to preface this. I want to dive deeper into the death data with you right now. It's not a topic that we really, or any of us want to talk about, but the data that I'm providing you today represents 80% of the fatalities associated with COVID in this county during the period of December 1st to January 20th. We may not have access to data related to deaths that occur in certain assisted living facilities or outside of outside of hospitals. So from December 1st to January 20th, those who have passed away since the beginning of December, of those in that time period, 35% were vaccinated, 49% were unvaccinated, 7% were identifying as partially, they started their vaccination, didn't finish, and 9% unknown, don't know the status. 35% of those who've lost their life during the month of December 1st to January 20th were vaccinated, 49% were unvaccinated, and 7% had some partial vaccination status. The average age of those who died during that period of those unvaccinated was 72 years of age, and the average age of those vaccinated fatalities during the same period was 78 years of age. Now, of the unvaccinated fatalities, 79% had significant comorbidities. So of the unvaccinated fatalities, 79% had significant comorbidities. Significant comorbidities could be a combination of several. It could be hypertension, obesity, COPD. It could be a significant battle with cancer or COPD. But 79% of those unvaccinated fatalities had significant comorbidities. As a reference, 100% of the vaccinated fatalities, those individuals who are vaccinated, 100% of those fatalities among those vaccinated had significant comorbidities. Again, not there for a single particular issue, but perhaps multiple comorbidities of some severity. There were 2 fatalities of individuals who received their vaccination and were boosted. So 2 of those fatalities were among those individuals who we were able to identify as having boosted the shots, and the average age of those 2 was 80 years of age, and both had significant comorbidities. And I want to be clear, this is like several comorbidities or one of significant severity. So we also know that the fatality data is what you would refer to as a lagging indicator. It is sadly, and again I've experienced this myself, it is the last of the data points that we would see. And so if you see, and it's a product of, to some degree, math. We had 8,000 active cases at one point. It is likely that a certain percentage of those would be hospitalized. A certain smaller subset would likely potentially lose their life. And so that indicator is always going to be a little bit behind. Fatalities are always going to be a week or two behind the cases coming in. And so we do expect to see continuation, sadly, of individuals losing their life, but we wanted you to be aware of those data points. Now, I want to do the same thing with hospitalization. So the 14-day average, so that's January 1st to January 16th, we've seen 163 individuals in hospitals. So 163 patients on average averaged over the last 14 days. Of those, so let's break down the data a little bit further. There are those who are hospitalized with COVID, and there are those who are hospitalized for COVID. Now, this is an important distinction for us to understand severity of the virus, but in the context of what a hospital must do to address an individual with COVID, they're basically the same. And so from a hospital's perspective, if you're in the hospital because of COVID or you're in the hospital with COVID, you came in with something else and test positive, they have to treat you the same way. You take similar resources in the hospital setting. But for us, as citizens, as residents, and as public health officials, knowing the difference is of importance. That allows us to gauge the severity of this particular virus at this point in time. So, 70% of local admissions are for COVID. So of the 163 patients on average that we saw in the last 14 days, 70% of those admissions to our hospitals are because they had COVID, while approximately 30% are there with COVID. Some other particular reason, test positive when they're there at time of admission. 60% of those hospitalized are not vaccinated. And 40% of those hospitalized, on average, were fully vaccinated. And so, important to know the data. We know that severity continues to occur among those who are unvaccinated with comorbidities of some significance. Ages. 1.8% of those hospitalized are 0 to 18 years of age, or 18 and under. 15.5% are 19 to 44 years of age. 27.3% of those hospitalized on average are 45 to 64, and 55.5% of those hospitalized are over the age of 65. Vaccination demographics, just as an update, we're at 84% of adults having received at least one of their doses. That number continues to inch upward. 75% of our total population has received at least one dose. 29.9, so 30% of those 5 to 11 years of age received their at least one dose, and 12 to 17 years of age, 67.3% have begun their vaccination. I want you to be aware that we've expanded access to both vaccination and testing. The JCPenney's location at the Poughkeepsie Galleria is open Tuesday and Thursday, 4 to 7 p.m., and Saturdays, 9 to noon. This is for vaccinations, and we ask that you pre-register, but certainly you can walk in. We just encourage you, however, to visit dutchessny.gov/COVID vaccine to register. Again, walk-ins are fine, but we'd encourage you to register. Now, we are opening the former CVS location in Dover on Thursday, January 27th from 4:30 to 6 p.m. This is in partnership with Dr. Neil Smoller. This is all ages, all brands of vaccinations. Appointments, again, are recommended, but you can walk in, but we encourage you to register. And that is Thursday, January 27th, 4:30 to 6 p.m. At the Dover former CVS location in the town of Dover. There are pop-up clinics that have been occurring throughout the county. I want to be sure folks are aware of them. Tonight, 4:30 to 6 p.m. at the Rombout Middle School in Beacon. Tuesday, the 25th, from 4:30 to 6 p.m. at the Arlington Central School District offices. On Friday, the 28th, from 4:30 to 6 p.m., the Pauling Elementary School, and those are obviously available to you as well. We encourage you to visit dutchessny.gov for more information regarding vaccinations. Now, testing, PCR testing remains at the JCPenney locations. This is at the second floor near the Best Buy entrance. We've expanded access. That includes rapid testing, and they are open Tuesday through Friday, 1 to 7 p.m., and Saturday, 9 a.m. To 1 p.m. I do want to note that the state of New York has provided us additional staffing resources to meet that full-time demand. And so while the state may have a state-designated site meaning they're staffing it entirely in some other counties. We've agreed to partner, which is perfectly fine. So our funded site, or our state site and county site, is the JCPenney's location at the Poughkeepsie Galleria. We're grateful to the state for providing us the staff resources to accomplish that full-time status. We are also making the former CVS location available and open in the town of Dover beginning this coming week. So Tuesdays and Fridays for several weeks, 4 to 7 p.m. Tuesdays and Fridays, 4 to 7 p.m. from January 25th to February 11th. The CVS location and in the town of Dover will be open for testing as well. Do want to explain that a lot of this has to do with not only capacity, meaning do we have the space to provide, but there needs to be a flow, right? If we open up and staff a facility and 5 people show up, it's not the most effective, nor is it something that we could support. So if you need the testing, and you want to be able to access the vaccination, those locations are available to you, and we want you to take advantage of those opportunities. Now, over-the-counter test kits, which, few things, right? The federal government's distributing them through the post office. I think if you go to the post office website, go to the post office website, you can find that link. I'll get to that in a moment. It's covidtests.gov. I'll get there again. And, of course, we also are distributing over-the-counter test kits as well. So over 10,000 kits will be distributed over the course of 3 days. We're doing this through large distribution points. That's the distribution we're doing this week. We do expect, as another allotment comes our way, that we'll return and distribute some over-the-counter test kits through the towns, villages, and cities, as we've done the last several weeks. We're grateful to them. But we'll be distributing over 10,000 test kits. The county will be on Sunday, January 23rd from 10 a.m. to noon. This is at the former JCPenney's at the lower level. This is a walk-up opportunity, and it's limited to 2 kits per family. So January 23rd, 10 a.m. to noon, 2 kits per family, JCPenney's location at the Poughkeepsie Galleria. On Wednesday, January 26th, from 4 p.m. to 7 p.m., we'll be at the Dover High School. That is a drive-through opportunity, and again, limit 2 kits per vehicle. And on Friday, January 28th, from 4 p.m. to 7 p.m. at the Dutchess County Fairgrounds in Rhinebeck, again, a drive-through distribution, and it's 2 kits per vehicle. And so keep an eye out on the county's Facebook page for that information. And if you have any need or desire to get those test kits, you can do that. I'll get to that in a moment as well. So the state of New York's making some test kits available, mostly to congregate settings and schools. As I said, if you're interested in securing a test kit from the federal government, it's a bit of a step, but it's a process. You go to www. or just covidtests.gov. So COVID tests, plural, covidtests.gov. You can sign up to receive a test kit through the federal government. You should expect that delivery to occur between 7 and 12 days after you order them. So we've had a couple questions throughout the week, even again today, regarding contact tracing. There is no contact tracing unless it is in the situation of identifying a cluster of cases in a congregate area. And so the state of New York announced Dutchess County and counties across the state have engaged in a winding down of contact tracing. You might say to yourself, well, why is that? There's more cases. There should be continued contact tracing. Contact tracing is used as a tool to limit transmission. If transmission is widespread, there is no limiting it through a contact tracing period or process. And we are at a point now where widespread transmission and decrease in severity means that you are going to be left with making important decisions in your own life, which is exactly the way it ought to be. And so contact tracing is not going to occur at the county level. If you test positive, you're not likely to receive a call from a county contact tracer. You may receive a text message that just says that there's some additional information, but you should not expect any communication from the state or federal government if you are a contact to a positive case. We encourage you to tell people that you came into contact with that you may have tested positive, just as you might have done if you had a cold or the flu or a norovirus. You might tell a friend, your cousin, your mother, I hope, your mother-in-law, that you were sick and you should watch your symptoms. The same is true in a school setting. Schools are not required, nor are they being encouraged to engage in contact tracing. We're not expecting that you receive or that we get a list of all students within 6 feet for greater than 15 minutes over a 24-hour period, and you shouldn't either. Just as you would, and again, I'll use a reasonable analogy, just as you might with neurovirus. Your child has a classmate that has neurovirus. You might receive an email that says one of your classmates has neurovirus. Watch your own health condition. That's what we're expecting. That's where we ought to be. And that is how we are treating this virus now moving forward. If you test positive, there's some isolation and quarantine requirements. We want you to be aware of those, know those. And if you want, you can watch a pretty detailed video from Dr. Santiago, our health commissioner. Just scroll down a little bit on the Facebook page, and she explains a little bit more regarding contact tracing. But we think that's important. That also means, by the way, that, again, you won't see it in a school setting. You shouldn't see it publicly. Also, questions about when we can take masks off kids in schools. Well, that is governed by the state of New York. We, of course, my position. My position is masking ought to be a personal choice. Just as if you get sick, we need you to make the personal choice now to inform your friends, neighbors that you may have come into contact with. We are at a point where we think that decision ought to be made by parents and students, and that's my view. It is, however, the state of New York's current mandate that masks continue to be worn in school settings. Now, the school superintendents in this region, to their credit, and county leaders did, in fact, again yesterday, asked the state, what's the measurement? What are they going to use to tell parents that there's going to be a change in policy? Today, the governor, in a press briefing, said that the masking requirement wouldn't continue for much longer. And I'm paraphrasing, but it's basically what she said. But we still don't know, and we think it's wrong not to have a metric. It's one thing to say, I don't know when you're going to get to the goal, but it's entirely different to say we don't know what the goal is. And we've been saying this for some time. The same is true on daycares. We don't think preschool kids should have to be masked. We just don't. We've said this consistently. It causes more concern than benefit, and the concept of keeping young kids masked in those settings is entirely it's absurd. It's not going to happen. And so there's been no change in that in the contact tracing and the quarantining requirements in daycares. We think that those things should align with the schools, so that kids, whether you're in a school setting or in the daycare setting, because in many cases they're not only preschool, they're older kids going to daycare. We think that the rules should be the same, matched, and that parents should be able to rely on their daycare provider in school and not have the confusion of one having one set of rules and another having another. That's what we've asked the state to confront. The governor was asked today by a member of the media to answer basically that question. Didn't have an answer yet. I'm not being critical. I'm just saying that we believe at this point we are too far along these last 2 years to not know what the measurements are and how the state's going to apply them. And I think that that's something that we ought to be a little bit upset about, because you should at least know how you're measuring and what the outcome is going to be. That I think is good policy from a public health perspective. Know what the measurements are, whether or not we've achieved those particular metrics, and then what the outcome of achieving those metrics are. I think that's good public health and government policy, and it's a good way of being transparent. State's not there yet. But I, again, offer what was my opinion, and that has been that masking ought to be an individual choice, and that we ought to be making, just as we are now, the transition to contact tracing. With contact tracing and positive cases, we ought to be in a position where you have to make important decisions on your own, and that is entirely appropriate in the society in which we live. That's, again, my opinion, but the state of New York continues to have the masking mandate in a school setting. And school districts are subjects of the state law. The county has no jurisdiction other than to say this is our view. We've pushed a little. I think you've known that. We've pushed a little to move on the contact tracing, the isolation requirements. I think we announced a reduction in the isolation requirements. The local newspaper wrote, Dutchess County's doing this before the state has authorized it, and I think 2 days later the state authorized it. So we're going to continue to be responsible. If you have questions, continue to send them our way. I hope that the data was a little bit more helpful. We want to provide that to you to understand. And again, it's important to know. And I do want to say this one last time. From a public health perspective, right, not a personal health perspective, from a public health perspective, we have a health department. That health department helps to ensure that widespread public health is maintained, that we don't have flare-ups of Legionnaire disease, of neurovirus, of a sexual transmitted disease, of COVID. When these things become so significant, public health moves in, makes policy decisions that help provide for some guide rails, if you will, to slow transmission, provide for public health, and protect large swaths of our community. At some point, those, however, become simply individual personal health issues. We're at a point where that transition is occurring. It's occurred in other parts of the world. Likely you have already decided that that's the way it ought to be, many of you. But from a public health perspective, knowing the data between who's in the hospital because they have COVID or who's in the hospital with COVID is important, because it allows us to determine transmission, widespread or not, severity, widespread or not. It's important to know, did an individual die because they had COVID with no other identified illness, or because COVID weakened what was their fight against other significant comorbidities? It's not to diminish the loss, certainly not. It's to be sure, though, that we understand the difference between public health and personal health. That we understand the impact that public health policy would have to reduce those kinds of things. Because again, if you're in the hospital with a significant number of comorbidities, public health action on COVID is not going to change ultimately that particular bit of information. So again, knowing that data helps us tell you when government should be involved and when government shouldn't be. And again, we are in the midst of this transition. I certainly would like to see it accelerated, and hopefully as we continue to see the decline in active cases and positive cases and in severity, the state of New York will begin to scale back its involvement in a lot of those policies and decision making. So I leave you with that. If you have questions, continue to reach out to us. You can visit duchessny.gov. You obviously can continue to watch here on Facebook, post where you can, when you can. We try to get to as much as many of the questions, if not specifically, generally, as we can. And in the meantime, we just encourage you to stay healthy, be strong, and be kind to each other.